Hello everyone, I hope you and your loved ones are healthy and safe. I've been receiving a lot of emergency calls in the past few days from dental emergency calls, and I decided to do this video to give everyone some tips that hopefully can help them to reduce the number of dental emergencies. They're very simple, you can use it at home, and I'm going to share it with you. One of them is adding hydrogen peroxide to your hygiene routine. Hydrogen peroxide is a great antiseptic, is very easy to find. You can find it at your grocery stores and pharmacies. It comes in a brown bottle. The reason for that is because the light decomposes hydrogen peroxide. So if you decided to change the container or put it in a different bottle at home, do what I did. I would suggest that you use a dark glass. That would be the best idea, so it would not decompose. You can use hydrogen peroxide in two ways. One is simply after you add your toothpaste to your toothbrush, you add a couple of drops of hydrogen peroxide. If it is a straight 3%, I would recommend just a couple of drops would be enough. If you have diluted it, then you can add a little bit more. Now that you have the good remedy to help your gums and your teeth, you want to spend your time doing a good thorough brushing. I would recommend at least 2 minutes of brushing time, doing each arch at a time, at the front of the teeth, and then the inside, and then the trim surface. Another way that you can benefit from hydrogen peroxide is using it as a rinse. If you don't have any inflammation in your gum or any infection, I would recommend 1/3 hydrogen peroxide and then 2/3 water. If your water, you have central filtration and your tap water is also filtered, that would be fantastic. If you don't have filter, I think the better idea is to boil the water and then have it in a container and use that. It would be more hygienic. So you brush your teeth, then you rinse with the hydrogen peroxide rinse for 1 minute, and then you floss. As you see, I have 2 of each one of our hygiene tool sets. You do not share your toothpaste, your toothbrushes, your toothbrush containers, or the cups that you use, the glasses that you use for rinsing. Here are some ideas. If you have different color cups, you can use them so they would not get mistaken. And if you are having glass or similar shape glasses, you can just label them. Why I'm saying that do not use the same container for your toothbrush or tongue cleanser, because it can easily be mistaken. You can use somebody else's toothbrush or somebody can use yours. And please make sure that you do wash your hands with soap and water for 20 seconds before you start your oral hygiene routine, especially when you are flossing. One other benefit from hydrogen peroxide, which is a passive benefit that you're going to get, is not only your gums are going to feel better and healthier, but also your teeth are going to be whiter probably. Alright, another quick tip that I want to tell you: if you are thinking about using this type of method for separating your toothbrush, please do not use that, because your toothbrush needs air to dry out. You don't want to put a wet toothbrush in a container and then close it, the bacteria can grow. The same routines, the same hydrogen peroxide and the toothpaste, you can use it with your electric toothbrushes. I hope these tips help you be help to you or someone that you know, and we can reduce the number of dental emergencies while we don't have that much access to dental care. Stay healthy and safe, and I hope we all pass this time as quickly as possible.